Schools and roads were some of the biggest focal points for the $81 billion budget signed by Governor Evers on Wednesday, but the budget could impact other needs in Wisconsin. News 8's Alec Giannakopoulos joins us with more on the increase in the budget that could help Wisconsin's most vulnerable citizens.
Jordan, included in the budget will be $320 million going to family care, nursing homes, and individual medical services to those who need it. With many skilled nursing facilities in Wisconsin facing potential closing, those I talked to today say that the funding is greatly appreciated. It's time to eat for Danette Svoboda and her friends at the Riverfest Senior Breakfast, but she wouldn't be able to come out if it weren't for a little help. Danette is deaf and struggles with asthma and diabetes. She receives help from a social worker.
She helps me with my laundry because I'm so short. They're doing their best. That's why I'm trying to keep doing the program what they need to do. Someday you might happen to your mother and dad. You never know, or a future loved one or something.
But recently, specialized nursing homes have been struggling to stay open in Wisconsin.
Our costs keep going up.
27 skilled nursing facilities have closed in Wisconsin since 2016, with 8 closing this year.
Our ability to attract and retain the workforce needed to care for some of the society's most vulnerable people has been very difficult.
Wilson says low government aid means the wages they can afford to pay skilled nurses are too low to keep a consistent staff.
Without them, we can't take care of people. They're really the people that are on the front line doing the bulk of the work.
Which is why the funding they will receive from the budget will go to the workforce.
Probably 90% or more will go to direct wages and benefits to attract and retain the staff that we need to care for people.
And as breakfast comes to an end for Danette, she hopes to be back next year and hopes those who help her get a little bit more help themselves.
We do need more funding. Yes, we do.
According to Todd Wilson, his center will receive a majority of the funding the first year of the biennium budget, and he hopes to put more funding into his workers' wages sooner rather than later.
Thanks a lot, Alec. Last year, the Department of Health Services had launched an initiative to add 3,000 nursing aides in the state.